Hi, my name's Hannah Lazar, and I'm checking off Brian today on the abdomen, and it's October 24th.
Okay. Hey, my name is Brian Buchanan. I'm a nursing student here at Liberty University. May I have you state your name and date of birth?
Joshua Lilly, 5/16/93.
Okay. Well, it's important to cover the patient, protect modesty. Okay. Just exposing the abdomen. I'm going to go ahead and inspecting the abdomen first. I don't notice any obvious inflammation of the abdomen. Scars, not evident. Symmetry, looking at an oblique view, is aligned, and pulsations are obvious right above the umbilicus. And contour, patient is more of a flat abdomen. And going ahead with and any obvious pulsations of the aorta. It's less prominent than distended. Moving ahead with auscultating the four quadrants of the abdomen. This is done two, 3 times each in each quadrant. Okay, after this assessment, I concluded that I heard 5 to 35 regular bowel sounds. This includes snaps, pops, gurgles, and just more abnormal bowel sounds. And if I did not hear any sounds on the patient's abdomen, I would go ahead and assess the patient's quadrant one at a time, 5 minutes each. And to conclude if the patient may be indicative of diverticulitis gastritis, if there was an absence of bowel sounds. Moving along with auscultation of the following main arteries: the aorta, it's left of the xiphoid process. The renal arteries along the midclavicular line and along the midline. Okay, here. The iliac arteries above the iliac crest and below the umbilicus. And the femoral arteries along the inguinal groove and along the midclavicular line. Okay, after this assessment, I've concluded I have heard no abnormal turbulent flow, no bruits, and this is normal laminar flow. And moving on to palpation, palpating, percussing the patient.
You have a few more things to auscultate first.
Auscultate the. I would go ahead and auscultate the umbilicus and the epigastric. And I've heard no abnormal sounds. And the spleen and the liver. Spleen first, located at between the 6th and 10th rib. And the liver. From this assessment, I've heard no friction rubs of sort. And moving on to percussion. First, I would assess the patient for liver span.
On your ear.
I marked the 2 points where I've assessed the patient for percussing dullness. Take my meter stick out, and the patient's liver span is above 8 centimeters. Usually between the 5th and 7th intercostal for the upper border, and right below the lower border of the liver is below the is below the costal margin. Moving on to the spleen, percussing from tympany to dullness. Okay, this was the point where I found the spleen, and moving on to percussing, and then moving on to palpation of the patient. Okay, and then I go on. Palpating the inguinal ring and the umbilicus for any tenderness. If there's tenderness present, this would indicative for hernia. Palpate the spleen. Press against the costal margin. Use your left hand, left flank to raise up. I didn't feel the spleen at the moment. Using the capture technique to feel for the kidney. Smooth, firm, non-tender. Left kidney, posterior. Both kidneys were smooth, non-tender. The right kidney was raised from the left one because of the diaphragm. And moving on to liver. Liver was food, smooth. Patient's not complaining of any pain, and in the bladder. And I palpate against the bladder as well in this assessment. Most likely it's a dull, and it's not. It's usually front. Moving on to testing following 4 tests, starting with allotment. I press against the organs for floating masses. I apply pressure and release. Okay, there's no, I didn't feel any thumping coming against my hand once I released from pressure. Next, the rebound test. I find McBurney's point. I release pressure with more of a stabbing formation of my fingers. If there's any pain, this would suggest appendicitis at McBurney's point. And the Iliopsoas Test had the patient. I would apply pressure to their knee while resistance is occurring by him raising his leg. If he complained of pain in his abdominal area, this would be indicative of increased peritoneal irritation. And the last test, the obturator test, had the patient cross his foot against his knee. I would move his leg medial and laterally, and if there's pain during this test, this would conclude obturator irritation, and that would conclude this assessment.